questions answered as quickly as possible. Nursing homes have been very challenged during the COVID-19 pandemic with issues such as staffing, staff training, making sure there's enough personal protective equipment, and infectious control procedures. Today, we have reported more than 4,000 total Connecticut residents have died as a result of COVID-19. More than 2,500 of those have been residents of nursing homes. Nursing home residents are the most vulnerable to this virus, and in an enclosed residential setting, the virus can spread very quickly. The Department of Public Health is making every effort to make sure nursing homes are properly cohorting or clustering nursing home residents together who have tested positive for COVID-19. We have also worked as a team in collaboration with other state agencies to establish COVID-19 recovery facilities that serve as places where people could be discharged from hospitals to recover while they're all still covering positive periods. During positive periods, these facilities have worked well, and there have been many who have recovered and then have been discharged to their original nursing home of residence. Combined teams of inspectors from the Department of Public Health and the Connecticut National Guard have made over 1,000 in-person visits to inspect nursing homes for infection control, staffing, and overall quality of life during the pandemic. That means they have visited every nursing home in Connecticut at least 4 times. We know the restrictions on visitation are particularly difficult for family members living on the outside as their loved ones are inside the nursing home. To make virtual visitation earlier, the Department of Public Health purchased more than 8,800 iPads that were distributed prior to Mother's Day weekend in order for families to have a FaceTime visits with their loved ones on the inside. This is important to note. We have also issued a directive to Connecticut nursing homes that outside visitations with families and loved ones is permitted if done properly through social distancing and families and residents are wearing personal protective equipment such as masks. Those can be arranged between the families and the particular nursing homes. As we move forward in this pandemic, we are constantly evaluating and reevaluating what policies we have in place in order to protect the health of nursing home residents and staff and keep people safe and healthy. Part of the quality of life of nursing home care is having access to loved ones and family members on the outside. We're taking a look at this very difficult question or evaluating if it will be possible to loosen some restrictions on visitation in the future as the reopening of the Connecticut economy continues. This is not an easy question to answer. There are many complicating factors, and again, our primary concern is the health and safety of nursing home residents and staff. As we move forward, I hope to be able to communicate about these issues directly with you in the near future. And please know that my team and I are always accessible to you, always through your state representatives, local health directors, and many other advocates. This has been an extraordinarily difficult and challenging time for all of us, and we are all in this together. I thank you for giving me the opportunity to address you, and hopefully next time it will be in person. Thank you, Senator Hwang, for organizing this important forum. End of comment. I appreciate the commissioner offering those words. It opens up a lot of interpretation, and I hope it gives some clarity. And this is why we have the panel that's compiled here. They will offer some of the viewpoints from the standpoint of real life application and hopefully be able to not only educate the public that's participating, but also to be able to educate perhaps the Department of Public Health about the importance of some of the underlying policies that she stated here. So I'm going to be respectful of the time. I'm going to go directly right now to State Senator Kevin Kelly. Senator Kelly is a longtime ranking member, was a former chair of the Aging Committee, elder law attorney. I have learned so much from him in regards to the issue of aging and advocacy and the infrastructure of caring for our seniors. And I remember the senator teaching me about the idea that our system and infrastructure, even before the pandemic, is insufficient. and we need to do better and we need to do more. That being said, what this pandemic has really exposed with these startling numbers, it is not simply a system, but a system that cannot handle the burden of what this pandemic has brought, and it has been a flaw that has devastating impact. So I want to welcome Senator Kelly. Thank you so much from your busy schedule, helping your constituents. But please, feel free to share your perspective, insight. I always value that. We're going to take you off. Hold on. Can we take Senator Kelly off mute? There you go.
There we go. So thank you, Senator Hwang, for the introduction. Also, thank you for putting on this important topic and putting together such a great panel with Penny, Marie, and Nora. This is such an important issue at this time, particularly coming off the experience of this pandemic. I am very, very happy to hear in the commissioner's letter that they are now going to open up and allow, this is the first I'm hearing of it from the state government, that they're going to allow the outside PPE protected, socially distanced visits, because it's so critical for caregivers, family, and loved ones to be able to actually eyeball their family member and loved one that's in a nursing home, because they are their eyes and ears. And they need to see in real time, real situation, what is going on. Also, to put things in perspective, you started with the 70% plus of all deaths in Connecticut were in the nursing home. But I think we even need to put that in a little bit more perspective. And that is, when you look at this nationally, Connecticut's, as you heard in the commissioner's letter, 4,000 deaths in nursing homes represents almost 15% of the nation's total died here in Connecticut. And the thing that is most troubling right now is, while the commissioner says they're working with the legislators, we really don't know what they're doing going forward. And that's what we really have to look at and focus on. I know we're getting about 1.4 billion from the federal government. A lot of, whenever the money is delivered to the General Assembly, it gets whacked up and placed in all different places. But when you look at how lethal this was to this population, I would hope, and this is why we need more transparency on what the governor is doing, I would hope that a substantial portion, because 70% of the deaths were in nursing homes, that a substantial portion of that 1.4 billion finds its way right back into that industry to protect these individuals from any type of resurgence come the fall. And all the experts and the modeling is showing in October, September, October, November, that this could in fact come back. And we know that there's been an underfunding of nursing homes with the reimbursement rate of Medicaid, also the lack of PPE, and as they talk about staff training and staffing. But most importantly, what I didn't hear in the commissioner's letter was anything with regards to testing. I think that's a critical component here, is that we must not only test the residents, but also the staff, and do so on a regular and recurring basis to make sure that anybody that is in the facility, is not transmitting or infecting other individuals. That's so critical, because at the end of the day, when we look at this, we have to protect, and that's what the whole purpose of why we did this, the human life that is vulnerable to this disease. So looking at that, we know a lot of the information. We know a lot of what the experience was. And the best thing now is to move forward. And I'm very happy, once again, I'll end where I started, that comment that we can now allow families to meet their loved ones outdoors. That's an important issue, because not only are they eyes and ears, but with the moving around of residents, and in particular, the keeping them in their rooms, their mobility has declined, and then they become more fragile and susceptible to other lethal conditions that we don't want to see those those rear their ugly heads and become, we protected them from COVID, but we exposed them to another issue.
Thank you, Senator Kelly. And you're absolutely right about the need for testing and the considerations for the next wave. When we get back around the second time, I'd love to get some solutions from your expertise to be able to offer to some of the people that moving forward. And I think that's important for us in this program, is to be able to provide solutions and guidance to move forward instead of looking back. So in regards to your advocacy, I can't say that enough, so thank you. But also in concert, you just recently did a forum with AARP Connecticut and their executive director of Connecticut, Nora Duncan. Nora, I will compliment you for the work that your organization does up in Hartford, but I also want to compliment you that when this first struck and the challenges began appearing in nursing homes and assisted living facilities, you were a lead advocate in championing for our senior community. Not only the ones that are in those homes and assisted living, but loved ones that have parents and family in those centers that are part of the AARP family. Please share with us what the commissioner's statement means to you, and also what are some of the real concerns that you have been fighting and advocating for that needs to be heard loud and clear, one by the people, but also by the commissioner and the administration.
Thank you, Senator. Hi, how are you?
Hi. The Zoom world that we're in, right?
I know. I feel like I'm getting like a 1 second or 2 second delay. So I feel like I'm out in the field doing, TV reporting, and I don't know when you finish talking. But so I appreciate you having me here. I appreciate Senator Kelly having me. I think it was last week. And I just want to acknowledge that, this is a really tough time for everyone, and we're in just such a terrible crisis of confidence, I think, in a lot of ways in America right now. And so while we're talking about nursing homes today, I just sort of want to acknowledge the amount of suffering that's happening everywhere, and be grateful for the leadership that we have and the peacefulness that we've had here in Connecticut. So when it comes to nursing homes, you're absolutely right. The unpaid family caregiver is actually one of the centerpieces of AARP's advocacy and education work. And the unpaid family caregiver is often the person who may be caring for someone at home. There's, almost 470,000 unpaid family caregivers for adults over 18 in Connecticut. And we can't forget, too, that people in nursing homes sometimes are not just seniors. They are people with disabilities. But unpaid family caregivers are also folks who have loved ones in assisted living or nursing homes and had been going in weekly, daily, sometimes multiple times a day to care for their loved ones for the needs that weren't, that were above and beyond what the nursing home is able to do. And those people were just all of a sudden on one day shut off from their family members, from any physical interaction with them or any visual interaction with them. And that started in March. And for good reasons. We understand why people weren't allowed to go into nursing homes. No question about that. So we began advocating for, at that point, virtual visitation and nursing home cameras, which we've been advocating for before COVID, and actually had a piece of legislation that did pass out of the Aging Committee. And then the legislative session ended for the same reasons that we're talking about nursing homes right now. So we had been advocating for virtual visitation. We got that and we got more, but it took until Mother's Day to get it, which was too late for a lot of people who unfortunately lost their loved ones. So when I don't want to look back, I want to remember why sometimes moving quickly and looking ahead at what we need to do, as well as reflecting upon our mistakes, is very important. I am thrilled that the commissioner issued that statement. I've been in contact as recently as 6:55 with the long-term care ombudsman, who assures me that more guidance will be out to nursing homes tonight or tomorrow about the fact that visitation in person with proper PPE will take place. I cannot express to you how much relief I have that that's happening to the people who have been asking for it. You know, people don't necessarily live in a window. Some people are on second, third, fourth floors, right? These are not, people have not seen their loved ones except for possibly with the virtual visitation in quite some time. And this will be an excellent step forward. I do want to focus on the moving ahead regarding cameras. We will continue to advocate, and I look forward to the General Assembly going in special session because I'm hoping we can get this on the agenda for nursing home residents and their families to have two-way cameras in their rooms. This is an important civil liberties issue for us. 13 states do this. It was important prior to COVID, and the fact that if those cameras had been in those rooms for people who wanted them and all the proper privacy stuff taken into account, HIPAA and everything else. So I'm not just saying everybody gets a ring. It wouldn't be that. But if those had been in place before this pandemic, we would not be in the situation we found ourselves in, fighting for virtual visitation, having to send 800 iPads. I'm currently working with a long-term care ombudsman for more iPads for our residential care homes, which are smaller and usually serve aging and disabled as well. So that's going to be a really important issue moving forward. And I wanted to just touch base on the testing. We did issue a letter to the governor at the end of May, I think it was the 28th, inquiring about if there was teeth behind the testing, as well as just asking for some clarification on what the testing means in terms of timing, and regards to staff. So luckily, an executive order did come out on Monday. The days are all strung together now, but on Monday for nursing home staff testing. So nursing home residents haven't left since March. So they're certainly not the ones bringing the virus in. So testing staff is just as important. And then on the final looking forward thing, probably more controversial, but I think it is time to take a serious look at the fact that many facilities, including nursing homes, and many different kinds of care facilities, have been granted pretty much blanket immunity during COVID. And while there's some room for obviously making exceptions, blanket immunity at a time when you cannot see your family or loved one, you are not getting the information you need, investigators are not going in the same way they did before. We are asking the governor to reconsider that immunity and look forward in a way that doesn't take us through September with that blanket immunity.
Wow. Thank you, Nora. And those are very interesting perspectives. And I do agree with you. You raised some very interesting points. But along with Senator Kelly, I think you share the idea that the idea of visitation is so paramount, not only from a opportunity to connect, but the psychosocial recovery for residents in those nursing homes and family members to be able to have that interaction. This is a startling new point that I'm glad that we're able to share, that this is something that's going to be a directive that is going to be very much welcome. And testing is absolutely critical. But you bring up a third point from a standpoint of maintaining the same level of care and the scrutiny that needs to be undertaken in that. Because I've heard from people's concern, has the level of care slipped for those that are not COVID impacted? Those are questions that we can't answer because of this quarantine aspect. So thank you very much for raising the very good point. So we have Senator Kelly, we have AARP, we have Marie Allen, who is the Executive Director for the Southwestern Area Agency on Aging. Now, Marie has been an incredible stalwart for senior advocacy. But what a lot of people don't know about what they do on behalf of families and seniors is they provide a myriad of services that people don't even realize exist. And what we wanted to do was have Marie be able to share beyond the nursing home policy and some of the impact that's going on. Talk about some of the services that SWACA, as the acronym, provides for individuals that aren't in nursing homes, but have family members that are struggling with that kind of communications. What kind of services or what kind of thoughts and feedback can you provide for people from a direct line service that your important agency delivers? you pretty much do about 80% of the social services work for seniors without getting the state and necessary federal money that you all deserve. So there's my pitch for how important you all are. So Maria Allen, thank you very much for being here.
Thank you, Senator Hwang. I think to start the conversation, we believe that every individual should live in the setting of their choice. And it should be the least restrictive environment that really celebrates a person's dignity and independence. If the right place is a skilled nursing facility, then so be it. But they should be afforded all the same dignities that they would have in the community while they're in a nursing facility. And many of our nursing facilities do afford those dignities. So I just want to say from the beginning, although we have seen some tragic results in the percentage of individuals infected with COVID and the number of deaths is disproportionate, we know that the perfect storm takes place in a nursing home where you have the most vulnerable people. You have limited staff serving more and more individuals. You have staff calling out sick because of their own contagious potential contagions or those of other family members. And you have one staff person supporting numerous people, which really does make it difficult to contain the infection. So at the Southwestern Connecticut Agency on Aging, or SWACA, our job is to help people live in the least restrictive environment of their choosing. And we do so by providing supports like home care supports, someone to come into the home to help with the activities of daily living, personal care, bathing, someone to help with dressing and transferring from a chair or a toilet to another, to the bed or into the kitchen. We help by making sure there's staff in your home who can help you prepare meals, clean the house, provide you with companionship and social opportunities, get you to doctor's appointments, etc. We do this through a Medicaid waiver. So in some cases, there are very strict eligibility requirements before someone can participate. In most cases, a person has to come near poverty before they can participate in the program. But for someone who has outlived their resources, these programs are extraordinary at giving you the option between a skilled nursing facility and remaining in your home, where you may be more connected to your friends from church, your friends in the neighborhood, your family, your grandchildren who can stop over. And throughout this pandemic, what I heard from a number of the 3,200 clients that we do keep out of nursing facilities is, thank goodness my mom is on this program and she's not in a nursing facility. So for some people, this was the lifeline. There are many other services offered through the area agency that include things like home delivered meals. At the start of the pandemic, we recognized that there were really two threats to older adults. The first was the pandemic because of their age and comorbid health conditions. They were most vulnerable to the worst effects of the virus. The second was, if I have to remain home and I can't leave my home, how do I get the care that I need to maintain my personal needs, to make sure that I have food, to make sure that I have my medication, and to connect to my doctors for those other chronic conditions, which could become more than just a nuisance if there is no access to healthcare. So we sprung into action, and we have been delivering grocery bags to about 3,300 Southwestern Connecticut residents every week. Our home delivered meals in both the greater Stamford and the greater Bridgeport area have gone up 72%. So we're making sure that people, if they need to stay at home, if the best course of action is to remain far away from the grocery store and other crowded activities, we want to make sure they can do so. Finally, health insurance, Medicare insurance, Medicaid insurance? Could there be something more complex? So at a time in your life when you need to understand your options as it comes to healthcare insurance, you're given some of the most complex programs ever to navigate. So we have trained counselors both in every community in Southwestern Connecticut, as well as paid staff at the area agency who can help you navigate if there's a problem between your Social Security account and Medicare. These trained counselors can help work through the systems. If you're having trouble applying for Medicaid and you're confused by the application, which I have to tell you, I have never met someone who isn't confused by the application, you can call us and we can help navigate through some of the more simple problems. And if it's more complex, we might make a referral to someone like Senator Kelly and ask you to go visit with him and really understand Medicaid. So I think, at the end of the day, Senator, it is an all-purpose organization. We can do some triage for anyone looking for assistance regarding any challenge of aging.
Thank you, Marie. And the listeners may be wondering, what does what Marie say connect to the nursing home challenge? And the reason I wanted to have Marie offer the array of services, because with this recent pandemic and the exposure to the challenges of nursing facilities, my caveat ultimately is there are in some cases very ill people in the nursing care facilities. But also I think what you offered from your initial statement is the freedom and the ability for people to live in the most comfortable setting that they have. And Senator Kelly has again taught me the importance of at-home care, and the resources that your agency offers may really come into play as this pandemic passes and people reevaluate what to do with their loved ones and their parents as they moved on to a certain age and needing of care. That there are resources through SWACA, through the various agencies that could complement at-home care, and that it is an option and a resource and an efficient method in some cases, if done properly, to deliver important care and home residence. So I wanted to share that with our audience and thank Marie for the incredible myriad of services that you offer in giving people the choices to stay at where they wish to be. That is a very powerful statement. And unless you have experienced it, you don't realize how important it is to an integral part of a whole health well-being system. I want to move on to Penny Young. Penny, I always kind of jokingly think that the last name is so appropriate for you because you are indeed the most energetic, active adult that I have known from a standpoint of your legacy of public service in being an aging advocate, from your work with Waveney and New Canaan to being chosen on Governor Rell's Aging Commission, to being a longtime member and board member of SWACA, to just also from your personal perspective, high energy community activism, and also a caregiver for loved ones. So the reason I wanted to invite you, one, is you give off such tremendous positive energy in such difficult times that we're experiencing, as Nora mentioned earlier. But I wanted to be able to bring a perspective of a peer group that is undergoing this whole process. We hear so much about from bureaucrats, from clinicians, from policymakers, but very few times do we see and hear from a population that is immediately impacted, that is really affected by this quarantine, from ones that are ill to ones that are trying to stay safe from quarantine and the challenges that goes through. So Penny, if you could shed some light in regards to what some of the challenges you've gone through, and also as a peer advisor for so many of your peers, what all of this means and how we can do better. So Penny Young.
Well, thank you. I'm honored to be amongst this esteemed group, and thank you for your nice remarks. High energy is what we all need during a situation like this, and you really can address it from just so many different angles. When you're dealing with an older population going through a time like this, there are many things going on in their lives that are confusing and challenging to begin with. And then you put something like the pandemic on top of it, and you really do have a very troubled group of seniors. I think one of the things that has been the most troubling is the lack of ability to be in communication with the rest of the world. If it weren't for Zoom and Skype and other modalities, a lot of people would not see any other human being other than what's on the television. And heaven forbid we want to focus on what's on the television, because it certainly isn't uplifting. And I will say that the Commission on Women, Children, Seniors, Equity, and Opportunity has, to my surprise, I will say, because it has not been all that active in the years that I have served on it, has actually been very active in this particular arena of seniors. The subcommittee has met several times. We have spent a good deal of time trying to identify issues that various communities have addressed in very positive, very successful ways. Challenges that other communities have had to meet, be they small towns or large cities, from all across our state, because the state is very varied in our various characteristics. And try to note what those areas are that need some attention going forward. I found two very interesting topics. One was the lack of cell service and internet service. And you take towns way up in the northwest corner of Connecticut, they have no idea what's going on because there's no service. And so it begs the question, is this something that the state needs to take on as something that the state provides every citizen in the state? Then you run into towns that are not going to want the towers and, you know, all those sorts of things. But as we've gone into a new world of communication and the technologies that are now existing and are coming down the pike, we're going to become more and more dependent upon, you know, access to cell and internet and so forth. And even among our seniors, so many senior centers across the state are offering virtual Zoom classes so that their members can be in communication, as all of us are right now, with others, and have that, you know, avenue of communication available to them. And another very interesting topic that I ran into, not only personally within my own family, but with the number of seniors that we're dealing with in town, is some legal issues. When the pandemic first hit, the number of people who went to their lawyers to make sure that their wills were up to date, there was a crush. And Kevin, I don't know if your office experienced it, but a lot of people said, are the wills up to date? In fact, our own children called me to make sure that our will was up to date. I said, fear not, and told her where all of my advanced directives were, and they're all prepared. So then that goes into the other documents that are very important for people to have, be they advanced directives or powers of attorney and so forth, that not everybody has. And despite the lectures that we give in senior centers and among our own lawyers and relationships with them is to have these documents, they don't. And as this disease has taken hold, then and created emergency situations where individuals are popped in an ambulance and off to a hospital, and the families are not, following with them, where's their advance directive? What do the hospitals know is permissible to do, not permissible to do? And it has created some really difficult situations in the hospital situation, and also in the skilled nursing situation. As I said, the families are not there as much as they had been there. And so the opportunities to have those kinds of discussions with family members to make sure that their loved ones have indeed signed their papers, doesn't present itself. So I think it is something that perhaps you as legislators might want to make sure that there is a common document that every healthcare organization mandates their patients to have studied, a healthcare representative. I know the Yale system has a very brief one. Yes, it gets witnessed, but not to the point of, two witnesses witnessing the witnesses. So it's an easier document to make sure that it is in everybody's file and will help that process of transition from a skilled nursing facility into, a higher level care facility. So I think out of every situation, there presents opportunities for improvements. This just might be one that would be really, really important to follow through on.
Well, Penny, I think you raise a very important point that sometimes is awkward and avoiding of a conversation. But this pandemic has brought forth some of the real necessary conversations that need to occur. And you do bring a perspective that many of, first, second generations and families don't always feel comfortable addressing. But a peer group like yours are readily understanding that there are challenges that you need to address head on. So I appreciate you bring that up. But I want to go back to the first point you talked about is the virtual quarantine, and that the real need for socialization and connection through either internet or phones or the ability to connect as human beings, the socialization process. So I want to go back to the panel in the order that we did, and really focusing on how important it is to really move forward with the contact and the visitation that we talked about earlier. I think it's important to kind of reiterate, if this is put in place in actuality, how powerful and important it is as a step forward for not only the patient care, but the family dynamics, but also ultimately accountability as well. So Senator Kelly, if you could talk about the possible opening, and I'm very excited about this because this is a news break on this, in the sense that if family members can now be able to see their loved ones with proper PPE protection and maybe meet them outside and have that sort of social face-to-face interaction, my gosh, how powerful and important would that be? Yes, Senator Kelly.
Yeah, I got to unhook my my mute button.
We're not in control here. It's the switchboard back there. But as I said, I wanted to be able to hear from all of you how important it is of this breaking news to say, hey, we got a redefinition. We're going to allow families with proper coordination with nursing homes, with proper protection, to be able to see loved ones. That has got to be an absolute breakthrough.
Well, and it's not just anecdotal. There's an actual 2012 report done by Nicholas Nicholson, who found that social isolation in and of itself leads to poorer health, poorer well-being, and a poorer quality of life. And I don't want to steal too much of Nora's thunder here, but the AARP Foundation actually then studied what is the cost of social isolation, just in and of itself. And they found that from Medicare appropriations, that's $134 a month is spent that doesn't need to be spent just because somebody's socially isolated. You put that over 4 million individuals receiving Medicare, and we're talking almost $7 billion we spend from the national perspective just on individuals who are socially isolated that we don't have to spend. And that's where, you start looking at this, and social isolation is just as lethal as the protections or as COVID. And so we need to make sure that people do have interaction, that they can go out. I mean, I forget who mentioned, I have residents in nursing homes who are clients and constituents who aren't, I'm going to say, senior. They do have their capacity, and they call me and say, I just want to go outside and get a breath of fresh air. Can you imagine not having a breath of fresh air for 3 months? That is, to the mental health of the individual is also a component. And this is why it's so important to not only allow the interaction, but it's an interaction with loved ones. I put out a letter earlier this week on the need for social isolation. And I had an individual constituent who contacted me and said that he had a stroke. He lost his voice. He lost movement in his arm. And if it weren't for family and friends coming in to continue to urge him to work the OT and the PT, to do what they have to do, and even though it was a difficult task, that encouragement gave him the strength to continue to soldier on, so that he does have his voice, he does have use of his arm. And that is why it's so powerful to have families meet with their loved ones, and so that the family and the loved one knows that they're going through it with them and that they're there. When you're separated, it's just, it was very long, these 3 months. And when the governor's order extended it to September, that was just, it was beyond the pale.
Thank you, Senator Kelly. And not to steal AARP's thunder, Nora, if you could share the follow-up study and really talk about the impact of social isolation, not only from an emotional cost, but potentially physical.
Well, I appreciate when senators throw my numbers out there for me, so I don't have to. See, this is a good thing. I will tell you this, as part of the same studies that AARP did on this, and I love the fact that we mentioned Nick Nicholson, because he's a professor at Quinnipiac we work with regularly on social isolation issues. It's been found that social isolation is the equivalent of smoking 15 cigarettes a day. So, I mean, I think most of us would rather just go back to smoking if that was what we had to do, right? The social isolation is so damaging that it is basically the equivalent of 15 cigarettes a day. Now, I am not Marie is going to know a lot more about this than me, but I've been hearing a lot from people who had family members who are in early stage dementia and are now have just evolved so badly as a result of the quarantining in the nursing homes, the failure to be able to see family. There are a lot of people, and if anybody, I will do a shout out to the state long-term care ombudsman, Marie Painter, and her staff, who hold Monday, Wednesday, and Friday at 5:30 p.m. Facebook Lives. I know Marie is paying attention to this Facebook Live right now. Family members repeatedly, I've learned more from that Facebook Live than I have in any other part of the work I've done on this issue. Family members repeatedly saying that my family member has not been able to leave their room since this happened, unless they were changed rooms because because they had to be shuffled around due to positive tests. This is, to the point, like, I haven't gone outside since March. This is got to stop. I'm so glad to see the progress. But the accountability issue, I think, is really big. Family members were going into nursing homes. They were providing extra care. Many people had, and I didn't know this until this pandemic either, were actually paying paid caregivers to also go in to supplement that care for their loved ones. They haven't been in either. I just find it hard to believe, no matter how good of a job a nursing home is doing, that the level of care can possibly be the same. And there are nursing homes doing tremendously good work. So I would just like to be able for people to see face to face, to get inspectors back in there, in the way that we used to be able to have the long-term care ombudsman staff in there like they used to be able to be. And I think I will give a final shout out for, the broadband issue. For those that live further away from their loved ones, if you have your loved one in a nursing home that doesn't have internet access, you aren't even having that kind of face-to-face. So that's also a great way to do telehealth and keep people from being exposed directly. So I just I look forward to seeing some really good changes in the next.
It's funny, Nora, I couldn't help it, but you talked about the broadband issue, and you're having broadband challenges from a standpoint, your voice breaking. That's the Zoom world that we live in, for the best of plans, but it's really important. Now, the AARP study, can you share that with us so that we can post it on and be able to share that with the various people? Great, thank you.
I can get you the link.
Marie, from your experience dealing with the plethora of your constituency that provide services, how important is that social interaction and the real toll that social isolation has on what you've seen in your members?
Well, thank you. I think what was most frightening to me at the beginning of the pandemic were the calls we were getting from family members whose loved ones were in nursing homes because of the lack of communication. So I'm going to take a cue from Penny Young, who has taught me over many years of mentoring me on the board of directors, and has always told me to look for the solutions. Mm-hmm. And when I think about the lack of communication, and the lack of communication from nursing facility to nursing facility, because the truth of the matter is, from the beginning, if your family member was at end of life and experiencing end of life care, as a family member, you had the right to go into the nursing facility, of course, using all the precautions of PPE, but you had the right to be there at their bedside and give them some comfort in their last hours. Some nursing homes didn't necessarily subscribe to it the way that perhaps they had, or were not articulating that to the family members of their loved ones. So we were getting calls saying, I have to get in. My dad only has hours left. I must see him. And someone on the nursing home staff had been misguided about the requirement. So I think when you look to the future, again, the pandemic caught us all flat-footed. None of us had enough PPE. I work with community-based home care agencies to try and maintain individuals in their home. None of them had enough PPE. They should have had more. None of us were really prepared to jump into action and support older adults. The federal government wasn't, the state government wasn't, none of our NGOs were really ready. No one could have imagined what we have just come through. But what's important is to now convene a group of people who are not looking to point fingers at anyone, but who are instead saying, what could we do better the next time? Where did we fall, and how can we fix it? How can we make sure families are communicated? I think knowing is so comforting, just knowing that, no, you cannot come in and see your loved one today, but here's why, and here's when we think you will, and here's what we're doing for them in the meantime. And here are the extra care that we're taking of them because we know you can't be there. So I think, I really think that we need to not allow this to end. What happened was tragic. There are lessons to be learned in home care. There are lessons to be learned in institutional care. And if we just step away from this and say, oh, it was all the skilled nursing facilities' fault, we are not going to learn anything. And should we have a resurgence in the fall or in 5 years with some new superbug, are we going to be any better prepared to deal with those issues? Also, I think we have to look at the role of large corporations that swoop in and they buy 7, 8, 12 nursing facilities. They have no experience in home care. Their goal is to make money, is not necessarily to provide care. So, you know, I'm hoping that we do have this debrief once life returns to whatever the new normal will be, and we are looking to make significant and substantial changes in the way we think about taking care of our loved ones at the end stage of their life.
Well, Marie, thank you very much. And Penny, since you were the one that kind of started the social isolation and the consideration on that, we've got another 10 minutes with the panel. And what I love to be able to do is, for a lot of the participants that are watching us, they're concerned about their loved ones, because in most cases, their loved ones aren't able to see this program. So you get a lot of people that are concerned about what they can do as a child or a caregiver or a loved one that are in the nursing home. What would you say, Penny, starting out, if you could leave them with one advice to get a sense of empowerment, a sense of what they can do instead of feeling so powerless, beyond what we just shared with them today, that the new directive to be able to have a connection and visit? I think that's powerful. But if you could, Penny, in quick terms, what would be the one thing you would suggest to the people that are listening in, what they could do to ensure that they have a sense of connection, a sense of control over this process of making sure that their loved ones are cared for and that they're there for them? So Penny? Penny, you're not on yet. Nope. There you go.
There you go.
So you heard what I said, right?
Yep,
what would be the one thing you would suggest to people that are listening in to kind of empower them, but give them a sense of control to some degree back beyond the virtual, beyond the visits? What would you say to them?
I think it's the power of communication. Looking at all the possibilities of ways that families and their loved ones can communicate with one another. We fortunately are living in a new world, the world of technology. When I've heard some of the stories of ministers giving last rites on cell phones, and families having communication with their members in skilled nursing facilities on their tablets and their Facebook or Skype or Zoom or whatever modality they choose. And it might, people have got to communicate to the facilities where their loved ones are and say, you know, I really need to be part of my loved one's day, however I can do it. Are we able to now see people through windows, through plexiglass panels? Can we type messages? Can we write messages and have them, you know, delivered? But there just are many, many different ways that you can communicate, and just have to take advantage of and being assertive in making sure that you have access to those modalities.
Thank you, Penny. And I know Senator Kelly has extended his time, so I wanted to have him offer his closing statement before he has to head off. Senator Kelly? Well, we got to unmute you first. There you go, sir.
Thank you, Tony. Just a couple, two points. As Marie had indicated, it's one thing to criticize, but offer solutions. Mm-hmm. And I think one of the things are, what are we going to do with this experience moving forward so that we can limit it or not even have it happen at all again? First and foremost, anybody that's out there that hears this, if they could contact the governor and their state legislators to utilize the $1.4 billion that's coming from the federal government to make sure that a substantial portion of that gets into the healthcare field, particularly skilled and assisted living facilities, to make sure that they have the proper testing equipment, that they have the proper PPE, and that that infrastructure is there. The second is really what Marie was talking about, and with the mission of SWACA, and that is that they've infused human back into human services. The whole idea of being able to age in place. If you stayed at home during this COVID crisis, you avoided that lethal nursing home environment. Since I was first elected in 2010, which was on the heels of the end of the Jody Rell administration, she was the administration that made the legislative finding that home care was a good idea with money follows the person. Well, I've seen nothing but a retreat from the state's commitment to aging in place initiatives, from the community spouse protected amount to Meals on Wheels to Alzheimer's respite to a refusal to increase the asset limits in the Connecticut home care program to I can remember going to the Easton Senior Center with you, Tony, because of the threat upon money, the
Medicare.
MSP program. It wasn't until there was a Republican tie in the Senate that we actually finally got the repeal of the income tax on Social Security. But the other initiative that I've talked with Marie about many times is the presumptive eligibility, to presume that somebody that's in the community is eligible so we can keep them at home. Home care is so much more important than people really understand. It's what every family wants. It's less expensive, and what we see now is better. That just makes sense. And if we are to return to Hartford with a special session, I would hope that we would look at that issue to start to rebuild and restructure home care initiatives so that every family is afforded that opportunity to stay at home and not have to be resigned to an institutional setting unless that is medically indicated or necessity in their health care plan. So hopefully going forward, we can avoid this. And it's certainly my hope that we focus on solutions rather than just look at, what the problems were from the past.
Kevin, absolutely. And that's why I really appreciate your input and your experience and insight. And I think it seems that we all learn from Penny, because it's all about addressing the problem and finding solutions. And that means the best idea wins. So thank you very much. Your ideas are fabulous at all times, Senator Kelly. Thank you for participating. If you got to go, you got to go. But Nora, if you may, if we unmute you. Thank you, Senator Kelly. Nora, what solutions do you have for us to solve all the problems in the world?
So one is I have to fix my Zoom to live broadband problems. That'll fix my first issue. It only happens when it's Zoom. I don't know why. The other is I want to, there's a couple of things I was going to mention, and Senator Kelly just said it so perfectly, is that we've strongly advocated all along for home care instead of institutional care unless absolutely necessary. There's a place for nursing homes. There's a place for people who really need them, but people want to be at home. I'm going to mess up, probably think it's 97% of people who we survey say they would like to age in place. That place doesn't have to be the home you had when you were 40, but it still needs to be your independent home. Staying out of a nursing home right now is more important than ever. And we do need to look at the policies that Senator Kelly talked about. He knows more about them than I do. He's the grandfather of them. And
a young one.
Honestly, a young one. He's multiple generations into it, but he's right. He's watching the erosion. That we've been there at the Capitol with our red shirts fighting at all of the budget hearings that we've had on Medicare savings program, on the home care program for elders, Alzheimer's respite, all of what he's mentioned. These programs on average, a little bit here or there, but cost about a third of what a nursing home does, keeps people where they want to be, and allows us to build supports around community. And, being able to stay safe and stay home could mean a lot more. You could sit on your back porch, when you're in your apartment with services and supports. So that's a really key issue moving forward. And then I'd also just like to add that I think in nursing homes, we probably need to focus a little bit more on the staff that are there to support the social and emotional welfare of the people who live there. Because I've been hearing a lot about, there's one rec coordinator, and he or she is in charge of all of the people having all of their virtual visitations and working through all of this. That's just not enough anymore. And so, while clinical staff is hugely important, we've got to focus on the social and emotional staff as well that exist in our nursing homes and when we move forward.
Well, thank you for the great work of AARP. And you raised a point that I want to take a minute to address and to offer again. I said earlier, but our clinical staff, our clinical assistants, are any of the workers in those nursing home environments, they are equally the frontline workers that deserve our attention, support, and recognition. These are individuals that are put through the gauntlet. They're in there providing care for loved ones at the risk that they're experiencing. And I don't think they get recognized enough. So if I could, just a shout out to acknowledge them for their work and their sacrifices, and hope that they're protected and safe, because they're doing yeoman's work to protect loved ones in a very uncertain situation. So I'm glad you brought up the workers and the staff that are there. They deserve tremendous credit. So Marie, we're going to let you close it out and talk about the support and aging in place. But what would you advise any individual that's listening, what they can do to support their loved ones, and as they consider future plans in light of this pandemic, when we get past it, what they can do to make sure that their loved ones and their have the best care, the best quality of life that's possible at a place that they like to be?
If their loved one is in a skilled nursing facility, I think it's so important to do surprise visits, come at different times, all different times of the day, on the weekends. Walk in, walk through the room. There's an adage that you should use all of your senses when you walk into a nursing home to identify the type of care someone's receiving. What does it smell like? What does it look like? Is it organized? Is it clean? What does it feel like? Think about things like the texture of the food they're giving your loved one. If your loved one has trouble swallowing, have they given him a hot dog? That's probably not a good thing. So really using all of your senses to identify the quality of care your loved one's getting. I do want to mention that you can go to medicare.gov/nursing home care, and there's a wonderful the star rating system, which was brought in 1986 to assess nursing home quality of care, staffing, activities, facilities. Those ratings are up on medicare.gov, and they can give a family a good sense of the type of care that's happening at any one nursing home. And then again, as I said, those visits and the care, and if your loved one can talk to you, how often has the nurse come by? How long do you wait when you have to use the bathroom to get assistance? How quickly are you getting your medication? Things of that nature, just to really assess what's happening in the nursing home. I think the other thing families should know, as Senator Kelly mentioned, Money Follows the Person has afforded individuals an opportunity to transition out of nursing homes, where 15 years ago it would have been unthinkable to bring a particular person home based on their ADL needs. Today, it's very possible to bring them home. Assistive technology is really changing the way that we work with seniors. Everything from medicine boxes that talk to you and tell you exactly which color pills to take, or emergency response systems that if you fall, it will actually recognize that your heart rate is not above a certain area in the room, and will send out an alarm so that emergency personnel come into the home. So I think that what we thought we knew 10, 15 years ago about keeping someone at home has greatly changed. And the best thing you can do is sit down and talk to an aging professional and really become educated about what the options are and what the preferences of you and your loved ones are, and make sure that you build a plan, a care plan that supports independence and dignity for your loved one.
Well, thank you. What a way to close the conversation is. Thank you all very, very much for your input. Ultimately, it's an ongoing process, and trust your instincts. I think what I come out on this is the fact that as you close, Marie, and saying, trust all of your instincts. Trust it. And if you think something's not right, demand accountability. And I think the new policy or the reinterpretation of the policy of having loved ones be able to visit and connect with their loved ones on a face-to-face will go a long way toward ending social isolation, demanding greater scrutiny and accountability. It's all a positive step forward to ensuring that our seniors at every location, every residence get the care and support that they deserve. So I want to thank you all for participating. Thank you all for what you do. I'm going to put this recording onto our website, and we will be able to link the article from AARP on social isolation. We will include SWACA and the input in the programs that we have to make all of these resources available to people that will gain a lot of insight as I have. So thank you, everyone. I appreciate it. Have a great day.
Thank you.
Be safe and healthy.
Good night.
Thank you.
You
Yeah,
too.
bye.
Good night.
Bye.